Okay, there we go. Back to, I feel like smoking a cigarette here because this is all the health debate shit. So yeah, you were talking about basically the polls here. 57% say they're willing to pay more taxes if it covers. So 57% want to pay more, but I ain't 57%. I'm the 1%. The one. Or probably less than one. However you want to throw that out there. That sounded fucked up. But as long as it covers. Everyone wants to go to heaven. No one wants to die. And they feel like paying, they think they want to pay for more, but when the cow comes home with sour milk, they're not going to want to drink that fucking milk. The only reason that I can come up with, this isn't solid or nothing, this is just armchair debate, right? The reason why it's so cheap over there is because the drug companies, the makers of fiberglass for arm casts or MRI machines can dump the cost here. X-ray technicians, all that 9 yards, they can dump it here or other free market places. Not like this is a free market at all. I want to hammer on that point though, that, where's my fucking hammer? It's out there. I want to hammer on that point that whenever governments get involved in a price fix, if the government says a bushel of apples will only sell for $7 and it costs the apple grove owner $9 to produce, he's going to let the fruit rot on the tree because it costs him more to bring it to market than he can get in return. Or he shuttles it underground to some other place. Psst, bushel of apples, $15. The same scenario. Price fixing does not work unless the overrun, or in the red part of the ledger, the dual journal ledger, unless the red part can be shoveled off to somebody else, some other place that isn't in that jurisdictional mandate. You cannot operate at a loss continuously. Period. There's only said amount of doctors, only set amount of beds, or set amount of blankets. You can only produce so many syringes. There's only so many MRI machines, only so many X-ray technicians, and there's only so many places that can facilitate a proper education to operate those types of things. Whether it's neurosurgeon, whether it's that MRI technician, whether it's that skilled janitor that cleans the entire place very disinfectantly to keep the surgery environment safe, or whether it's the manufacturer of those scalpels. It all, the price has to be paid. And people say the free market is screwing up the price, so we have to fix it. Well, the free market isn't screwing up the price because the price fixing is screwing up the free market. Back to the apples. The free market solution is doctor, patient. That's it. Insurance company adds that cost into it. The only reason Medicare can quote that statistic is because they get to mandate how much to charge, how much that doctor gets paid, how much that hospital bed is worth, and they underflow the overrun costs to other people who don't have that strong arm price fixing capability. It is very complicated, but just like walking, it's simple. It is very simple. It depends on your perspective. I know you said that about something else before. You can't make the complicated simple. You can't overcomplicate the complicated or whatever. But it all depends on your perspective. A star shines light. That's simple. When you examine a star, woo, it takes you to very complex places. Yeah, I'm loving it, and I'm not a nihilist. If they do enact it, cows will come home to roost. If they don't enact it, the only reason they're pushing so hard on it is because Medicare and Medicaid, with the baby boomers that are about to, within the next tick-tock 4 to 6 years, are going to just bum rush the government for all the things that they've been entitled to. And that is going to bankrupt us. Well, no doubt about it. It's between $50 to $70 trillion. A good place to go is shadowstats.com. I think it's .com. Anyways, I'm gonna stop here. This is just off the cuff, really off the cuff. But examine, if you can find it. Examine. When did the prices start skyrocketing? Seriously. When did they start skyrocketing? It's not because of the technology. It isn't. This shirt didn't skyrocket because they had automated machines. The shoes didn't skyrocket because they had automated machines. This camera I'm looking at didn't skyrocket because of manufacturing and technology capabilities. That drives prices down. So, when did healthcare start to skyrocket? Look that one up. Alright, man. Anyways, I hope everything's cool. So, later on, dude.